Today's question is, can turmeric replace painkillers for joint pain? So if you've ever had joint pain, whether it's arthritis, knee pain, lower back stiffness, you probably know how quickly doctors will prescribe painkillers. The problem is that these can have side effects and don't actually fix the root of the problem. So what if nature already gave us something powerful and it's sitting right in your kitchen? That's right. We're talking about turmeric. As a physiotherapist, I'm going to break it down. First, you have to understand why joint pain happens. So most joint pain comes from inflammation. Conditions like osteoarthritis, rheumatoid arthritis, or cartilage wear trigger swelling and pain. So our bodies kind of overreact and send in too many white blood cells to fight the damage, which can make the joint even more unstable and painful. This is where painkillers come in. They stop the pain signals getting to the brain so you feel better. Medicines like ibuprofen or paracetamol work by reducing inflammation or blocking pain signals, but they don't actually heal the joint. It's like putting a Band-Aid on a cut. It stops the bleeding, but you still need to clean and care for the wound to make it heal properly. So now let's talk about turmeric. So turmeric is a golden-colored spice that's been used for centuries in medicine. It's a natural source of curcumin, which is a compound with anti-inflammatory and antioxidant effects. Research shows that curcumin works on the same inflammation pathways as painkillers do. For example, it inhibits cyclooxygenase enzymes, also known as COX inhibitors. COX-2 inhibitors are a class of painkillers that reduce inflammation by blocking the production of prostaglandins, which are chemicals that cause pain and inflammation. Celebrex is an example of a COX-2 inhibitor. By blocking these enzymes, curcumin reduces inflammation and pain. But unlike painkillers, curcumin doesn't have the same potential for side effects like stomach ulcers, kidney issues, or dependency with long-term use. So let's see what the studies say. Several clinical trials have evaluated the effectiveness of turmeric supplements for osteoarthritis. One study published in Clinical Rheumatology found that a combination of turmeric and black pepper was effective as a painkiller, reducing pain and stiffness in people with osteoarthritis. Another study in the Journal of Clinical Biochemistry and Nutrition showed that turmeric supplements were well tolerated and significantly reduced inflammatory markers in overweight or obese adults with knee osteoarthritis. Now let's talk about the effects. So painkillers provide quick relief, but they only treat the symptoms. They mask the pain and inflammation, but they don't actually heal the joint or address the root causes of the problem. Turmeric, on the other hand, works a bit slower, but it supports the body's natural healing process. It reduces inflammation and promotes tissue repair, which can lead to long-term benefits for joint health. Also, turmeric has other effects that may indirectly help with joint pain. For example, it's a potent antioxidant that can help protect against cellular damage and reduce the risk of chronic diseases. It also has antibacterial and antiviral properties. The best results come when you combine turmeric with black pepper. That's because black pepper contains piperine, which helps your body absorb curcumin better. Together, they make a powerful team. If you want to try turmeric for joint pain, here are some tips. Look for high-quality turmeric powder or capsules that contain at least 1,000 milligrams of curcumin. Remember, more is not necessarily better. Start with a small amount and gradually increase it based on your needs and tolerance. Always talk to your healthcare provider before adding turmeric to your diet, especially if you're taking blood-thinning medications. Turmeric is great, but it's not a magic bullet. It's best used as part of a comprehensive approach that also includes physiotherapy. Here's why. While turmeric reduces inflammation, physiotherapy addresses the root cause. For example, we focus on strengthening the muscles around joints, improving flexibility and mobility, correcting posture and movement patterns. These things can significantly reduce pain and prevent future injuries. In conclusion, turmeric is a natural remedy that shows promise for joint pain relief. Its anti-inflammatory properties can help reduce pain and inflammation in conditions like arthritis. However, it's essential to use it wisely, starting with a small amount and being patient. Combining it with black pepper can enhance its effects. Remember, while turmeric is great, it's not a substitute for professional medical advice or treatment. For long-term benefits, it's best to combine turmeric with physiotherapy to strengthen muscles, improve flexibility, and correct movement patterns. Together, this combo can help you feel better and move freely so you can enjoy life to the fullest. If you found this video helpful, please share it with your friends and family. Thanks for watching and see you next time.